Hello and welcome. I'm Josh Schimmels, publisher and CEO of the Los Angeles Business Journal. It's a privilege to be here today hosting what is now our mid-year 2025 Healthcare Roundtable discussion. The healthcare industry, as we know, continues to evolve at an unprecedented pace. From emerging technologies to changing patient needs, leaders in healthcare are navigating a landscape that demands agility, innovation, and a whole lot of collaboration. Despite these challenges, professionals across the field continue to lead with purpose, driving innovation, improving outcomes, and ensuring that patient care remains at the forefront. Today's conversation is going to explore a wide range of very timely topics, everything from AI and data security to shifting patient expectations, something that's so important, regulatory updates, which we've seen a lot of, cost-saving innovations, and opportunities for regional collaboration. We're joined by an esteemed panel of experts who will share how their organizations are preparing for the future of care, the trends they're most focused on, and the bold moves needed to move healthcare forward here in Southern California. Before we jump in, I just want to extend a very special thank you to our three partners, our friends at Foley and Lardner, PIH Health, and UCLA Health. Thank you all so much for your continued partnership and all that you do to keep our community of business and the regions safe. I have the honor of moderating today's conversation, so please help me in welcoming our speakers. First up, we've got Jason Fisher, Vice President of Operations at PIH Health, Good Samaritan Hospital. He's also the System CIO at PIH Health. Next, Johnny Spiso, President of UCLA Health, CEO of the UCLA Hospital System, and Associate Vice Chancellor of UCLA Health Sciences. And Judy Waltz, Healthcare Partner at Foley and Lardner. Welcome. It's so great to have all of you here. I'm going to start off with a question for the entire group. Healthcare is evolving rapidly, as I mentioned, and whether it's policy shifts, which we've seen a lot of, continued advancements in technology, which we love, or changing patient needs, which is so important. If you had to identify one way that your organization is preparing for the future of healthcare, what would it be and why? Jason, let's start off with you.
Sure, Josh, and thank you for the question. Obviously there are multiple ways here, but if I boil it down to one in an area that I am deeply invested in right now, it would be technology advancements and organizational change. PIH Health has recently announced a shift and a migration from our current EHR, electronic health record platform, to another health record platform that will take us out over the next 15 months. And what we're intending, and the reason why behind this, what we're intending from our advanced electronic health record platform are greater operational improvements and efficiencies that we expect to positively impact the way that we interact with our customers and our patients.
Well, I think that's so important. We'll talk about operational improvements and how technology is helping that in a little bit more. Janice, same question. What are your thoughts?
Well, thank you, Josh, and thank you to the LA Business Journal for hosting this. I think as we all know right now, healthcare funding is complex and we're in an evolving and changing landscape. So the potential for significant changes in the coming years here are really great. Here at UCLA, we've been taking a really proactive approach in addition to what Jason mentioned in the investments in technology. And I know we're going to talk about artificial intelligence, and I'll be excited to tell you what we're doing in that field. But we've also stepped back and looked at our population, with 10 million people in Los Angeles County, what's happening and how are the changes in the demographic. And one of the things that we've seen is definitely the aging of the population. So we stepped back and launched our own Medicare Advantage health plan by UCLA Health to really give us the opportunity to really do very good population health management, really improve the value of healthcare for seniors. So our Medicare Advantage plan launched last year, and we're really looking forward to the improved outcomes in that as we navigate this changing landscape. Additionally, we've been looking internally at the organization and thinking about, as we continue to expand capacity, we're a health system that operates at 110% capacity. How can we really move more intensive care to lower sites of care to create more capacity and access? And we've got 2 big facility expansions opening this next year, and I'll talk a little bit about that later.
I imagine population health management, probably a term we're going to hear a lot more of in the future.
Yes.
Wonderful. Thank you so much. And Judy, what are your thoughts? Judy, I think you're still on mute.
Sorry about that. So I am a lawyer, and so the things that we are looking at are the legal side of a lot of these issues. And I would say that, first of all, there's so many issues that are going on, but the most pressing, I think, have to do with funding for basic health services going forward, for the Medicaid population, for grants, for what's called parity and equality of pricing amongst sites. There, drug prices. There's so many challenges to the fiscal structure, and trying to help our clients understand those and fight them when necessary is it's a very pressing and ongoing situation at the moment.
Yeah, and we'll dive a little bit more into that later. Thank you so much, and welcome. We're going to stay on tech for a minute. And Jason, this one is for you. As we all hear on such a regular basis, data security it's top of mind for all businesses, and including healthcare leaders right now. It seems every week we see a Fortune 1000 company in the news for a ransomware attack. It's on the rise. And it's not just the big companies. It's small businesses. It's your sandwich shop next door. It's the large business down the street. We're seeing this as a major issue. How are you guiding your organization in protecting patient data?
Yeah, Josh. So you're absolutely right with everything that you just said. We are very much a security-oriented organization and have been for many, many years. It is really the only way to do business in the world that we're in at this point in time, both in and outside of healthcare. Ransomware attacks are increasing in both their frequency and, more importantly, the sophistication of the attacks. And protecting the sensitive patient data we have in the healthcare vertical is critical not only to our patients' safety, but also to our operations. So at PIH Health, we've implemented a multidisciplinary approach to this that we continue to advance on a year-over-year basis, implementing cybersecurity frameworks such as the National Institute of Standards and Technology, otherwise known as NIST. That has helped us to guide the protections around our sensitive patient data and has helped to really drive our program and our investments, which continue on really a day-to-day basis, more so year to year from an investment standpoint. In addition to that, I think what's very, very important is regular awareness training. We provide that and require it of our staff, contractors, caregivers as well. That awareness training is tested through quarterly social engineering campaigns that we push out to our organization. And those are intended to be as tricky as possible given the nature of the environment. And then I would say, lastly, on the technology side, we've got, all the traditional tools and the advancing tools in endpoint protection, network segmentation that we look at to advance on a regular basis for aging operating systems where we may have those or backups and recovery, disaster recovery processes, vulnerability and patch management, which occur on literally a day-to-day basis. And then we've engaged, at many years, we've been engaged with an annual third-party audit of not only our technology, but also our security controls throughout our organization. That occurs throughout the year in various and different capacities, which provides us with insights into how we're doing, where we need to advance, where we need to put a little bit more attention to as we, round out these challenges that we face on a day-to-day basis.
Yeah, I think that's so important. We engage like so many other companies in very strong and often proactive cyber training, just making sure that your employees are in the know and have information. One of the things that I think that's interesting that's come up quite often and more recently is the sophistication, as you mentioned. We see AI being used in business. We're also seeing AI being used by threat actors, and the level of sophistication of some of these phishing campaigns is getting more and more difficult to decipher. So it's all about education, and making sure that your employees are on top of it. Let's talk about the law. Judy, you mentioned all of the changes that you see. There's upcoming laws. There's changes coming. What California specific legislation or maybe regulatory changes do you see on the horizon that you feel could really move the needle in the year ahead? What does that look like?
So, from my perspective, the biggest challenge is going to be the California budget and how they handle the Medicaid, which in California we call Medi-Cal, how they handle the changes that are coming down from the federal side and implement those in California. California has, maybe always, but certainly in the last few years, has had one of the most progressive and inclusive Medicaid slash Medi-Cal programs in the country. A lot of those options are going to be going away, at least in terms of federal support. And so California is going to have to figure out if it can come up with the money to support some of those programs and offerings, or how they will deal with providing health care to a large population that is covered by Medicaid. So I think that is going to be a big challenge, not just for providers, but obviously for those who are covered by Medicaid slash Medi-Cal here in California. And also, I think it will impact public health. So I think we are at something of a crisis point in terms of how healthcare will be delivered in California going forward.
Yeah, I think that's something that we're all going to be keeping our eyes on. Thanks for that. Janice, back to our favorite topic, AI, technology, innovation. I've had a chance to hear you speak on innovation and how UCLA is using AI and technology. So thank you for sharing that insight over our recent podcast. But for those who have not had a chance to listen to the episode, tell us a little bit about what UCLA is doing at the forefront of innovation as it relates to AI and technology. Perhaps how you're using AI or data analytics to improve care delivery, whether that's for outcomes, which is so important, operations, and even the patient experience. What does that look like?
Yeah, well, thank you, Josh. And as our organization, UCLA Health, in addition to the clinical care that we do, we're training that next generation of healthcare professionals and conducting over $1 billion worth of scientific research each year. So we have been, over the past several years, deploying AI tools that we didn't even call AI a few years ago that are actually using large language models and other things. We focused initially on our business systems, compliance, revenue cycle. We were talking about data security. One of the tools we began using several years ago is a tool that is doing constant surveillance on our electronic health record. So every day we can see anyone who's logged into a record, anyone who's not a care provider, we get a report from that. The other areas that we've then launched into are the patient-facing ones. So the business tools were a lot easier to implement, if you will. The patient-facing tools are the ones that are a little more challenging. A lot of things on the regulatory side and then on the patient disclosure. But we've been able to do that with success. So tools like ambient listening, so that we're deploying a tool in clinic settings that is listening to the interaction between the physician and the patient. At the end of that visit, it summarizes what was discussed So the physician, instead of during the visit typing on their computer while the patient is talking to them or while they're assessing, really can be free to be actively listening to the patient. That has been adapted very well by not only our physicians, but also patients. Additionally, all through the COVID-19 pandemic, we were using tools like a chatbot. We were getting hundreds of thousands of calls a month, and we were able to really have standard scripts and things being in real time delivered to patients. So when we look across the organization now, we have about 50 different tools deployed, about 30 of them on the business and finance side, and about 20 of them in the active clinical setting. One of the things we did this past year is we hired a chief AI officer, one for the health system that really looks at all these tools. You can imagine with 45,000 employees and all of team members being interested in innovation, every week we were getting requests for new AI tools. So we really wanted to have a process to sort those out and look at what is the impact of implementing these, what is the cost of converting those tools to use. And then in the School of Medicine, we also have a new chief AI officer that is looking at the scholarly components of that. Our IT services here are large. On the health system alone, I have over 1,200 employees that are working in IT services every day, a huge portion of that on the whole data security piece. But inside there, we also have an arm that is looking at all the tools on data and analytics. We're really excited about that because we really feel a lot of these tools will allow our research to be really completed in a more efficient manner. We feel on the patient care side, it's going to really allow a lot more safety features, tools that we're using in imaging and radiology, for example, that also do an additional read. Everything we do is signed off and reviewed by attending physicians, but these tools are really helping care be more accurate, more accessible, and more timely. So we're really excited about the future of those.
Well, that's a lot. I'll tell you at a recent doctor visit I had. I think at one point there was a very thorough visit. I probably spoke for 15 minutes, and I noticed the doctor wasn't writing anything down yet. When I looked at my physician notes in the after summary, every single word was perfect, and just the summary was spot on. That's that ambient listening that you refer
Yeah.
which is great. So building on this, Judy, staying on technologies, when new technologies are adopted, there are ethical and sometimes privacy questions. What concerns are you seeing most often, and how are you advising your clients and organizations in the industry to work through them?
So, the basic framework for us has to do with PHI, protected health information, and the access to PHI and the protections that have to be given to PHI come from an old statute, old at this point. It's been updated in more recently than some federal laws have, but it's still relating to different technology. So having AI involved is like HIPAA on steroids and involving both privacy and security issues. So privacy being, the patient, I would have expected you to have received some sort of consent during your recent visit, telling you that this was going to be transcribed by AI operating out of a server in India or whatever it is.
By the way, I should add, I'm pretty sure I signed when I checked in that day.
Okay,
I
good.
did do an updated form, yes.
Okay. So things of that sort, though, like if you're using an overseas server, and I'm hesitant here because we have a CIO on the line. I'm sure my terminology is not the latest and greatest, but it will work for now. If you're using a server in an overseas country that isn't governed by U.S. laws, there may be additional issues there. There are also security concerns with AI builds on information that it has, and making sure that patient PHI is protected is very much a challenge, and how you deal with your vendors, and it really is HIPAA on steroids.
Yeah, I think
Say
that's
nothing of the state laws that supplement all of HIPAA, so like the California laws.
No, thank you. One of the things that, as we look at new innovation, we think about costs. And earlier, I think we heard the term operational efficiency. Sometimes new technologies and new innovations can reduce costs, but a lot of times they don't. They can improve technology. Sometimes they reduce costs. That they're not always they don't always go together. So I guess my question for you, Jason, is does one usually come at the expense of the other? Or are you seeing innovation helping to reduce costs more often than perhaps you would expect?
Yeah, Josh, I think it really does depend. I mean, if you are an innovative organization, there are definitely circumstances where you need to fail fast. The investments that you're making may not pan out to fit within your business model. However, achieving both, and I would say that, as in the role that I'm in, pushing for technology improvement to improve care and reduce costs are at the forefront of what we do every day. Achieving both of those requires a very intentional strategy, thoughtful implementation of the technologies and alignment with the culture of the organization as well. Technology does always introduce upfront costs. I think everybody understands that. However, what we do here at PIH Health is really focus on a measurable return on investment. That may not come in the way always of financial return, but there are returns that may bring patients back to your organization. Or, as spoken before around ambient listening, there's a measurable return on the impact to the caregivers and the providers that has as well, that is often not really spoken about. Beneficial opportunities to lower overall cost obviously is a key priority for us, but improving quality over time in whatever facet of the organization that you're in is very, very important. We navigate those disparities and the targeted ROIs for all of our key investments. We leverage lean process improvement techniques to enable us to really evaluate how we do business in a specific area before we embark upon any change. I think that's very, very important. We've been really pushing enablement of patient-centered tools, putting the patient in the middle of everything, managing their care, providing them easy access to the organization, whether it be ambulatory or ancillary practices and services. And then the use of data is very important for us to evaluate how we're doing on a day-to-day and a regular basis.
Yeah, I think the phrase "fail fast" is such a great takeaway, and something that we've heard over the years from so many great leaders in different industries. And it's just as important today. Maybe now it should be fail faster. The faster you can fail, the quickly, the faster you can succeed. Thanks for sharing that, Janice. Let me ask you this, and let's expand out just a little bit from your perspective. What's perhaps one or one of a few of the biggest challenges that hospitals are facing right now? And then what are you and your team doing to address it?
Yes, thank you, Josh. I think one of the biggest challenges facing healthcare systems here in Los Angeles and also across the country is really the cost of healthcare, the rising cost in the care, the rising cost in staffing and supplies and pharmaceuticals, and combined with the reductions in funding. As Judy had mentioned, really, we're looking at not only reductions to the state Medi-Cal program, but federal funding in Medicare as well. And it's all coming at a time when hospitals are overflowing. We in our 5 hospitals run 110% occupied in our 300 clinics. That's why we're rapidly having to invest in more facilities to expand access to care. So it's really quite a challenging time. So I think the hope on the horizon is we can all continue to use technology to make care more efficient, to hopefully reduce the cost. But the ability each year to keep up with that, every year, even with nothing changing, right? We usually have about $100 million to a $200 million gap to reduce just to balance our budget at UCLA Health. In addition, in California, we have some unique challenges. So in our county of 10 million people, we have about 4 million people in California on Medi-Cal. So rising numbers of Medi-Cal, reducing numbers of commercial insurance. So the ability to maintain a balanced payer mix and have a viable financial bottom line is why many hospitals are really struggling. Here as well, we have a unique shortage of certain types of beds. So mental health, inpatient mental health, we're one of the lowest per bed per population in California. It's one of the reasons why we made a major investment at UCLA Health in buying a campus that had closed and now embarking on an investment to bring forward an inpatient mental health hospital with about 139 beds and expanded outpatient mental health services. That was about a $600 million investment with a population that we know does not cover services. So I'm still figuring out how we're going to pay for it all. But the reality was we were sitting with our ERs overflowing with people, adults, pediatrics, adolescents, geriatrics, who need access to inpatient psychiatry. So it is really looking at, every year we look at a community health needs assessment. Where is the greatest need and how can we be a part of that solution? But we can't do it alone and definitely need collaboration with the whole health system, with our federal and commercial and state payers as well.
I mean, the ability to balance $100 million budget gap is no easy feat, and it certainly illuminates the challenges of the industry right now. Thank you for sharing that. Judy, in your role, in your area, you work with many, if not all of the major healthcare organizations across the industry. I'm going to put you on the spot here a little bit. If there's one change that you believe hospitals and providers must make, they've got to make it now to stay relevant, what would that be?
So this is going to sound a little pedantic, but it's something that I tell myself as well. It's not limited to healthcare providers. I think we need an attitude change. We need to embrace the idea of change. We need to encourage and reward resilience and creativity as much as we may be chafing under some of the things that are going on. It is what it is, and we've got to figure out a way to deal with it and move forward. So, as a former government lawyer, I've done my own grieving in terms of the federal workforce and my friends who've lost their jobs, but it is what it is. We have to figure out a way to move forward.
Yeah, I mean, forward's the only way to go, especially in an industry where every day there's something new to learn and that can help benefit patients. We've got a changing environment as we discussed, and I also think patients today, they expect more. They expect something perhaps different, in particular in the post-pandemic world. So Jason, I'm going to do the same thing for you. I'm going to put you on the spot now a little bit. What shifts are you seeing from patient expectations? And then how is PIH Health evolving to meet those expectations from your patients?
Yeah, thanks, Josh, for that question. So, we're finding that even post-pandemic, the trajectory around patients being informed, connected, and expecting the healthcare industry to follow suit with all other verticals is increasing at a pace that we candidly need to just keep up with. The personalization of healthcare we feel is very important here at PIH Health. Patients are expecting that personalized care, on-demand access, technological conveniences, cost model transparency, and continuity really across all of your healthcare settings within your enterprise. Here at PIH Health, even prior to the pandemic, we've been working really hard towards meeting and exceeding our patients' expectations and meeting them where they really want to be met. We're offering virtual care options, self-scheduling in our ambulatory space and moving that into our ancillary departments within the hospital, messaging, many patient portal expansions that we've done here over time, digital check-in, and secure interactions with our patient care teams. We're really encouraging that walk-in access and really focused on getting a patient the care that they need in an extremely timely manner. And then, of course, developing as simplified as we possibly can in the healthcare industry, their financial experience as well.
The term technological convenience is, I think, really appropriate and something that patients absolutely expect today more so than ever. And then, the other term that you mentioned that I read so much about is personalization of care. That seems to be at the forefront of healthcare moving forward, because one size does not fit all as it comes down to individuals and what their needs are. Johnny says, as you look ahead, what's perhaps one or two strategic initiatives that your team's going to be focused on over the next couple of years to really stay ahead of the curve?
So one of the things that we've been focused on as a health system is really expanding. Our key challenges are not enough inpatient beds, not enough ORs, so very busy, overflowing emergency departments. So a year ago, we purchased a hospital in the Valley and made that UCLA West Valley. We're looking forward to the opening of our new UCLA Mid-Wilshire campus that will be psychiatry and allow us to then add an additional 100 beds here at the campus of Ronald Reagan UCLA and UCLA Mattel Children's Hospital. In addition, we've been opening about 8 new clinics a year throughout Los Angeles and Southern California, and ambulatory surgery centers and imaging centers. And so one of the things for oncology, for example, we have 20 centers throughout LA and Southern California where we do a lot of oncology infusion, our Simsman Center for wraparound care. We do a lot of our clinical trials there in those areas. So we feel by continuing to expand access, right, we can treat patients sooner in their disease process, have better outcomes, and also eliminate some of the inefficiencies that we have every day where everyone queuing up and waiting for beds. So that part has been key. The second big area has been really delivering on value-based care, making sure we're really following our evidence-based medicine protocols to make sure we're giving the right care to the right patient at the right time.
Yeah, this is all so important, in moving forward for care. Thank you so much for sharing that with us. I'm going to ask one last question. I want to thank you all for being here because, this type of update for our community, for our readers, it packs a punch. What we can learn in 30 minutes and then pass it on to others that we think would value from it is so much. One trend that I think we would all agree is probably not going away. We're seeing consolidation. We're seeing a lot of collaboration, which is fantastic, and I think only benefits the patients at the end of the day. And we're seeing new partnerships being formed. So I'm going to ask each of you one question to close out here. Parting thoughts. If you could lead or champion one collaborative effort across Southern California's healthcare landscape, something that would really move the needle, something that would really benefit everyone the most, whether it's a policy change or a new partnership or a bold tech move, what would that be? Judy, let's start off with you. Judy, you're on mute.
I was starting to say that was a hard question before I realized I was on mute, but it is still a hard question to answer. In my dream world, we would all embrace the idea of public health and understand that all the pieces work together in terms of the big ecosystem of healthcare. So that includes both insured and non-insured and usual operations. An idea that having a population that is more healthy benefits all of us, and using that as something of a lodestar in terms of our goals.
Thank you so much. Janice, your thoughts?
Yes, I think, continued collaboration in the healthcare system to really maintain the safety net and access to care. And that not only involves all the hospitals, it involves the California Hospital Association, the Hospital Association of Southern California. We know we have big changes coming in healthcare. We have seismic regulation that is hundreds of millions of dollars of capital, and many places won't be able to make those investments. So what does that do then to access to care, to keeping emergency departments open? So I'm looking forward to our ability to work together as a healthcare system for our community.
Thank you so much. Yeah, the work that HASC is doing is so important in bringing hospital systems together to address some of these issues. Jason, final thoughts.
Yeah, I'm going to dovetail off of the patient expectation discussion that we have and really throw out access initiatives. Too often we hear that patients are waiting days, weeks, or months to receive the care that they really and desperately need. If a facility needs to partner with another facility to provide the highest level of care required for that patient, access and time are always of concern. There, of course, are multiple challenges with this approach, such as insurance and capacity. But while there are many efforts in these areas that are ongoing, it would be a great community partnership for the outcomes of all of our patients and our consumers.
Yeah, I think these are really important parting thoughts. We've got public health, continued collaboration, and access to initiatives. Initiatives don't result in positive gains for patients if there's no access to them. So thank you for pointing that out. This has been such a nice conversation. I really appreciate all of you taking the time to invest for our communities, to listen, to learn. Jason, Janice, and Judy, thanks for your thoughtful contributions, your leadership in the industry. Again, these are really important conversations. I would say now more than ever, as we see so many changes on a national level on the landscape, people are going to be impacted, and it's important to understand where we are and what's coming. So thank you for sharing. To our audience listening, if you found value in this and thinks there's people in your networks that would get value from it, please share, put it up on LinkedIn, send it out to your team at your company. These are such important conversations for us to have. Thank you all for being a part of this. We look forward to hosting another update on healthcare soon. Until then, stay safe and stay healthy.